Welcome back to the podcast, everyone. I'm Dr. Khan, and today we're peeling back the layers. Quite literally, we're diving into the accessories of the skin, the appendages. Think of the skin as a high-tech suit of armor, but it's these appendages, the hair, nails, and glands, that provide the climate control, the lubrication, and the sensory feedback.
Exactly, Dr. Khan. And while they might seem like cosmetic details, for the boards in clinical practice, they are vital. We are looking at the nails, hair follicles, sebaceous glands, and sweat glands. Let's start at the fingertips with the nails. Dr. Khan, why do we care about these keratinized plates from a clinical perspective?
The nails are our built-in tools, Sarah, but clinically, they are a window into infection. The nail sits on the nail bed, surrounded by nail folds. Now, why does this matter clinically? Because those folds are prime real estate for pathogens like Staphylococcus aureus. If you see an infection between the nail and the fold, that's a paronychia. It's painful, red, and can really ruin a patient's week.
High yield point there. Paronychia is a term you'll definitely see on exams. Moving inward, let's talk about hair. Hairs grow out of follicles, which are essentially invaginations of the epidermis diving deep into the dermis. The base is the hair bulb, which is concave to fit the vascular hair papilla. That papilla is the life support for the hair.
I like to think of the follicle like a flower pot buried in the ground. The bulb is the seed, and the papilla is the water and nutrients coming in from the soil. And don't forget the shiver factor, the erector pili muscle. It's a tiny band of smooth muscle connecting the follicle to the dermis.
That's a classic exam favorite. The erector pili is innervated by sympathetic nerve fibers. When they contract, you get goose flesh or goose pimples. Clinically, this is huge when assessing shock. A patient in shock often presents as pale with goose flesh because their sympathetic system is in overdrive, causing vasoconstriction and pulling those hairs upright.
It's the body's fight or flight showing up on the skin. Now, let's talk about the oil in the machine, the sebaceous glands. These are usually tucked into the angle of the hair follicle. They secrete sebum, which is basically the body's natural hair conditioner and skin moisturizer.
Precision matters here. Sebaceous glands are situated on the sloping undersurface of the follicles. If the duct of a sebaceous gland gets blocked, maybe from a comb injury or an infection, you get a sebaceous cyst. These are incredibly common on the scalp.
And if that follicle gets infected by staph, you get a boil. But here's where students get tripped up. What's a carbuncle? Why does this matter clinically? A carbuncle isn't just a big boil. It's a staphylococcal infection that has spread into the superficial fascia. It's often a group of infected follicles, and we see them most commonly on the nape of the neck where the skin is thick.
That leads us to the final appendage, the sweat glands. These are long, spiral tubular glands. For the boards, remember that sweat glands are the most deeply penetrating structures of all the epidermal appendages. They go through the full thickness of the dermis and can even reach into the superficial fascia. That depth is everything. It's the secret to how we heal from burns. Think of these deep appendages as reservoirs of epithelial cells. If a patient has a partial thickness burn, the surface skin might be gone, but the cells deep inside the hair follicles and sweat glands act like seeds to regrow the surface. This is why a deep burn that goes past the sweat glands heals so slowly. It only heals from the edges. Which is exactly why we use skin grafting. In a split-thickness graft, we take the epidermis and the tips of the dermal papillae, but we leave the deeper parts of the hair follicles and sweat glands at the donor site so it can repair itself. A full-thickness graft, however, is much more complex. It includes the whole dermis and needs a new blood supply fast.
You really have to be the doctor of choice for your patient when managing these wounds, weighing the speed of healing against the risk of contracture. If you don't have those deep appendages to help regenerate, you're going to see a lot of scarring and pulling of the skin.
We should also mention that sweat glands are everywhere except for a few specific spots: the red margins of the lips, nail beds, and the gland's penis or clitoris. If you see a question about where you won't find sweat, those are your answers.
Great point. And before we wrap up, let's touch on the creases. The skin over joints always folds in the same place, the skin creases. At these spots, the skin is thinner and firmly tethered to the underlying structures. It's why your palm looks the way it does.
It's all about the connection between the dermis and the underlying deep fascia. In the palms and soles, the superficial fascia has numerous bundles of collagen holding the skin tight to handle all that friction.
So, to summarize for our listeners, the appendages aren't just extra. They are the key to regeneration after injury, the indicators of sympathetic stress, and the most common sites for skin infections like paronychia and carbuncles. If you understand the depth of these structures, especially the sweat glands, you understand the logic of wound healing.
Perfect summary. Remember, sweat glands are the deepest, erector pili is sympathetic, and partial thickness burns heal from the seeds in the follicles. See you next time.